Okay, let's talk about mold. I'm Dr. Vincent. It's another sort of LDI-based video. This is a little more general about mold-related illness. We get a lot of people contacting us asking if we can help them with their mold-related illness. What do they call it? Mold toxicity, mold allergy, blah, blah, whatever. So I'm going to try my best to explain to everybody the difference between mold allergy and mold toxicity, because those are incredibly different things, okay? And we can treat mold allergy using LDI very successfully. We don't have any, LDI has no application in terms of mold toxicity, however. So it's important you understand the difference. Both of these things exist, right? You can have either one, or you can have both of them for sure. So you have to understand what's treatable with LDI, what's not. Mold toxicity occurs if you have a really significant and usually prolonged exposure to toxic molds that produce, toxins that go through the air, like Stachybotrys, black mold, and certain other varieties. So that's going to be historically relevant. Like, oh, I lived in this moldy building for 5 years and I got progressively more and more sick while I was in there. And that's the thing about mold toxicity. It takes time to occur. And once you have accumulated a toxic burden of toxic level, or symptomatic level of mycotoxins within your body, you will be chronically persistently ill. And the illness symptoms you have will follow you wherever you go. So you go on vacation to the Maldives or whatever, Maldives, for a week, and you still feel like crap. You don't get better so much. You might feel a little bit better just because you're on vacation and that's a happy time, but you'll have your same fatigue, brain fog, weakness, heart palpitations, dizziness, burning sensation in your body, whatever you happen to get from your mold toxicity. So it goes with you everywhere. A big distinction there is that mold allergy will only occur, the symptoms will only be present when you are being exposed. So I have cleaned all the mold out of my house and I feel great in here. But when I go to my friend's house who has like a water leak in their walls, I can smell mold right away, and immediately my nose and eyes might burn. I feel foggy, I feel sick all over and fatigued, and I got to get the hell out of there. Okay? And once I get out of there, I feel better within like half an hour or something, the symptoms go away. So with allergy, the symptoms are only present when you are being exposed to the mold, with some variation. In some people, there's a delay in the onset. Like, they can sit at their friend's house for a few hours, have dinner or whatever, and they feel a little crummy, but they really feel worse tomorrow. Like, the next day is when really everything piles in on you, and you just spend a couple of days in bed until it wears off. That can happen with mold. Mold sensitivity reactions are a little unique in that sense, in that there is somewhat commonly about a 24-hour delay in the real severe onset of the symptoms, and that's because of the way the immune system reacts to fungi, to molds and other fungi being a little different than the way it reacts to a lot of other types of antigens. So that might be your pattern, but still the symptoms will be linked to exposure, and when you get away from exposure, you get better. And if you're in a mold-free environment, you feel fine in terms of those symptoms. So if you feel bad all the time, even though you've cleared the mold out of your own house and whatnot, then the symptoms you're having every day are not mold allergy. They could be mold toxicity if you still have a big burden of mycotoxins in your body, but oftentimes it's something else entirely. Just as a segue, most of the people that I have come to me that think they have mold-related illness to explain their chronic symptoms don't. They have something else. They had mold exposure in the past, but who doesn't? Every human being lives around mold. Every human being has mycotoxins measurable in our urine if we bother to pay for the test. If you got $600 to burn, everyone has mycotoxins. It's in the food that you eat, it's in the air that you breathe. That's not abnormal, okay? But if you had a significant hit and burden of mycotoxin exposure before that did make you sick, oftentimes that caused an immune reaction to occur to something else entirely. So a lot of those people became reactive to candida in their body, or they became reactive to Borrelia, or they became food sensitive, they became chemically sensitive because of the severe insult of the mold exposure that they had. So those people will go through 6 months to a year of mycotoxin elimination with, cholestyramine or clay or charcoal or whatever binder they use. They may even do the whole protocol where they end up with the VIP spray, the whole thing, and they're not better. Well, if you did all of that, then the symptoms you still have today are probably not mycotoxin related. You'll probably still have mycotoxins in your urine every time you're tested, and your mold doctor might tell you, well, then you're still sick from mold. That's not what that means, okay? That does not mean that. If you did a year of mycotoxin elimination and you're still chronically ill, then we need to explore other possibilities for why you're chronically ill. The symptoms can seem just like the symptoms you had at the beginning, but you can have more than one cause for the same symptoms, okay? So, like I said a minute ago, most of the people that come to us that think they have a mold-related illness no longer do have a mold-related illness. Now it's probably something else. And oftentimes it's some chronic immune inflammatory process that was catalyzed or initiated or caused by their mold exposure 5 to 10 years ago. But now it's a whole different problem. And so don't get locked in mentally to mold, especially if you've gone to great lengths to eliminate the mold problem from your environment, from your body. Then let's explore other possibilities, please. A lot of people that come to us that have been convinced by their practitioners or what they read on the internet that they're sick from mold, like I said, they're sick because of something else entirely. So you have to broaden your horizons at that point. Definitely try to deal with the mycotoxin thing first. Do the binders for 6 months or more. You should feel better, okay? You should feel tremendously better, gradually and progressively, and get to a point where you're like, oh, okay, I'm good. But if problems persist, then we have to entertain other possibilities, okay? The mold allergy thing is very easy with LDI. So LDI works extremely well. When I made my own environmental mixtures last year, I created a mold subset, so I can actually give people the mold mixture by itself if we want to. Like if you're also allergic to animals or pollen or dust or something, but the level at which you react is different between them, we could give mold at a separate dose different from animals or dust, mites, or whatever, if you want to, which improves our overall success with complicated people. But if you can tell me when I go to this particular place, or I go to a barn, or in the fall when it's raining and wet outside, I go outside and I smell the mold from the decaying leaves on the ground, I get symptoms XYZ every time I'm exposed to mold, then we can completely work with that with a good degree of success. High, like 90% or better success. We can get rid of that part. So you just have to have a mold exposure that you use, and then we use that as our test exposure every time you take an environmental or a mold LDI dose. You take your dose, about 6 days later you have your mold exposure, you go to the thrift store, you go to the friend's house, you go down in your basement, you go play in the barn, whatever. Or you get a moldy wash rag from your shower and you put it in a Ziploc bag, and then you like open it at arm's reach and take a whiff, or use your washing machine or whatever. And you tell me if your reaction to the exposure has changed or not. I'll be doing a video purely on relative change, so we can discuss that. And that's worth watching, hopefully. I haven't made it yet, so I'm predicting that it'll be worth watching. So that's the deal with mold allergy. And still, people will sometimes have difficulty understanding mold toxicity from mold allergy. How are they not the same? They're just not. They're two totally separate things. So like, a good example I can give you is Tylenol. You can be allergic to Tylenol. When I take a Tylenol pill, I get itchy and I get hives all over, okay? And it happens within 15 minutes of swallowing the Tylenol. If I don't take Tylenol, I'm fine. Or you can have Tylenol toxicity. I swallowed a whole bottle of Tylenol because I was really depressed, and then 3 days later you're dead. Your liver completely shuts down and rots, and you turn yellow and you die. That's Tylenol toxicity. Okay, those are very different illnesses. There's a different level of exposure that's required. There's a different time frame, and in this case there are different symptoms. I also use dogs as an example that's not quite so gruesome. A dog, you can be allergic to a dog. You walk into the room with a dog and your eyes itch and your nose runs and you sneeze, or the dog can bite you. That's a dog-related illness, but a totally different one. So the mold toxicity is like the mold biting you, and then the mold allergy is more like the dog allergy. And hopefully that makes sense, and hopefully you'll understand what we can treat with LDI and what we cannot. So if you're a person who believes you have a mold toxin related chronic illness, And what I just said makes you think, oh, then you can't help me. I need you to ask yourself a couple of questions. Well, did I do mold detoxification for more than 6 months? Meaning I took some kind of intestinal binders twice a day for 2 or 3 hours, sipping on it over the time, and that's the right way to do it. You know, I did aggressive mold toxin removal, and I cleaned up my environment at home or at work or whatever. If you did that stuff and you're still sick, then you should talk to me, because your problems are not mold any longer. The vast majority of the time, it's some other problem that you acquired through the course of having mold-related illness. So we can usually still help those people, because a lot of times they have a chronic immunological problem that's been initiated by the mold exposure. But using the mold antigen is not the answer for those people. Okay, you got to understand that it's something else at this point. If you don't think you've done adequate mycotoxin elimination yet, then do that first. Satisfy that question, answer that question, do I have mycotoxin-related illness or not? But stop doing the urinary tests, because the urinary mycotoxin tests are going to show up toxins in almost everybody on any given day. So that's really not the answer to the question. It's, did I do thorough detoxification or not from my body? Okay, you can only shed so much mycotoxin in a day, no matter how much is piled up in your body. So the mycotoxin amount you find in your urine could just be from your day-to-day food intake that you normally eat, and it doesn't reflect any body burden that's still remaining, if that makes sense. You should also ask yourself, if you totally cleaned out your environment, you know, you did all those measures, like I've been a good boy or good girl, and I've done all this stuff for mold and I'm still sick, and then we should have a conversation about what else might be going on. The other thing is, and there will be major pushback on this, that all of the laboratory testing that is supposed to mean you have a mold-related illness can mean lots of other things. You know, it's like MMP9 and MSH and, you know, some TGF-beta, C4A levels, like all these inflammatory markers in the body are non-specific indicators of inflammation. They do not mean mold is the problem. They just don't, okay? It's like if you have a fever, that doesn't mean you have strep throat, even though strep throat usually entails a fever, okay? It's non-specific. You can have a fever from a bladder or a kidney infection, or you can have a fever from pneumonia, or you can have a fever from an ear infection, or you can have a fever from meningitis, okay? So having elevated inflammatory markers that may mean mold does not mean mold. And please get that, I hope that gets through to people, because people want to tell me about their labs, and like, oh, I still have all these markers. I'm like, yeah, that doesn't matter. We know you're sick. Those just mean you're sick. You have chronic inflammation, and we have to figure out what's causing it, and it doesn't mean mold. The other thing that is utterly useless is the HLA genotyping that is popular among the mold, you know, organizations and groups, the mold following, as it were. Those HLA markers that say, oh my gosh, you're susceptible to mycotoxins, you'll never get rid of them, you're going to be mold ill forever, that's bullshit, okay? That is not what that means. It's a predisposition at most. It is by no means a guarantee. You know, like, HLA markers are predictive, but the predictive value is minuscule. There's not a guarantee there. Like if you have the HLA indicators for celiac disease, which I think is like HLA DQ2 and DQ8, I think. If you have one of those or both of those, it doesn't mean you're going to have celiac disease. It means that instead of the baseline 1% in the population chance of having celiac disease, you might have a 5% chance of getting celiac disease. It might up your odds by 5-fold, but it's still 5 out of 100, right? Not 100%. So the HLA tests, just don't waste your money on any of those. Genetic tests in general, I wouldn't waste your money on, unless it's a purely genetic disease. But HLA typing in particular is just not useful. So to recap, if you have mold allergy based on exposure causing symptoms predictably every time, get a hold of us, we can help you with that. Or some other doctor who does LDA, or somebody who does NAET, or sublingual immunotherapy, or provocation, neutralization, whatever, you know, type of immunotherapy you want to try. If you think you had mold-related chronic illness, but you dealt with the mold what you think should be adequately, then we might be able to help you with that too. And if you haven't done the work on getting the mycotoxins out yet, and you wonder if that's part of your problem, then Do that to completion, 6 months to a year. Unfortunately, it takes a while. And if you're still sick, then we might be able to help you. And I think that's enough to say about this subject. Thanks.